The Older Americans Act and the additional funding we received from the Minnesota Board on Aging helped our Older Americans Act providers expand the services that they deliver. The COVID-19 pandemic prevented many providers from delivering their services face-to-face as they have been doing for decades. An example of that would be the stay-at-home order and all non-essential medical appointments being canceled in March of 2020. So our providers pivoted their services to maintain connection with older adults to ensure their health and well-being, to ensure that they were staying connected, and to continue to support older adults and the caregivers they serve.
Well, we provide a number of health promotional, nursing, volunteer, and outreach services. Some examples would be nurse visits by our community nurse for the seniors that tend to have more pressing medical and health issues. We've really expanded our food distribution and delivery services in response to the pandemic. We got an emergency grant last year from Trellis for Title III-B services, and that's for homemaker and special access services. And we hired Ahmed, our Somali Elders Coordinator, at the end of September. So we were in the process of hiring for it, but it helped us secure enough funding to actually move forward, and that was a critical step forward to enhancing our services to Somali elders.
The seniors are very, specific about when it comes to food and where they're getting from that food culturally. So we collaborated with a local halal supermarket, and they were able to deliver those specific meals to the Somali community, such as halal meat, food that they're familiar with. So us having that conversation, we figured that out. There was a huge need of food security. There was a huge need of personal practice. There was also this situation where there's isolation, so there was a lack of communication. Last year, what we have learned is that how important it is to have a technology, access to have a technology. What we have learned, especially the Somali senior community, is that there were a lot of isolation, and then there was a lack of knowing how to use that technology, or not even having access to that technology. I have been with the organization a year now, and it's my job to do the outreach and assess the needs and the ones in that community. I think the organization values my position, and they are absolutely committed working with diverse communities, especially serving Somali seniors. We know that there is diabetes it's in Somali community. It's a big thing, and a lot of them express that they're interested, having classes or a training around that, what to eat and what is healthy, and classes like that. So those are the things that we wanted to try to work with before the COVID, and everything changed, of course, after the COVID. So it's something that we're keeping in the future.
We're a membership organization with 30 other nonprofits that provide home-delivered meals to people in need. The services that we provide to older adults really do enable them to stay in their own home and live happy and healthy lives, while having that personal contact with a volunteer, or even the phone conversations that we've been having over the past year. Over the last year with the COVID-19 pandemic, it's just been a tremendous demand for our services. And more so than COVID-19, I think creating that need, I think it's really exposed the need that's already existed in the community. We work with our organizations in a unique way. There is not, most Meals on Wheels organizations in the country are larger social service agencies where they'll serve an entire county or an entire metropolitan area. In the Twin Cities, we have kind of the best of both worlds, where we partner with smaller nonprofits who work directly in their community and have good relationships with their clients, have really good relationships with the volunteer base, but don't necessarily have the infrastructure for economies of scale, or some of the reasons that they founded Metro Meals on Wheels was to operate on a regional scale. So whether that has to do with outreach or funding applications and so on. So we contract on a larger scale with Trellis to provide home delivered meals, and then we subcontract with partner agencies, so the money kind of flows through there, and then we handle the administrative side of it too. So instead of having 30 different organizations that are contracting, we have one. Our Trellis has one, and then we work directly with them to ensure that we're keeping up with the standards and really reaching people in need. We've really reached into communities that we haven't traditionally served as well, and developed new partnerships over the past year and a half. We work with Aphrodite to serve halal meals to Somali elders, and that's actually transformed into some additional, more long-term partnerships where we've added 2 different members, the Lake Street Kitchen and Moscow Noor in North Minneapolis, to continue those services into the future. So things that we wouldn't have done so quickly, I think, without a pandemic. But knowing that need was out there, but not really being able to articulate that or really understand that until we were able to completely open our doors, thanks to the support through the Older Americans Act, to provide services to folks that it was a little harder for us to reach prior to that outreach. So one of the great things about the Older Americans Act funding is there's technically no income limits to it. The biggest gap that we see in the Twin Cities is that some meals are reimbursed through Medicaid. It's actually a pretty significant amount of the total meals that we provide through our membership. But there's a huge gap between folks that are on Medicaid and folks that can actually afford the full cost share. So that's where the Older Americans Act is critical in filling that gap, but it's a really huge gap. So that's one of the challenging things that we have is the targeting of those funds, and the fact. I mean, the entire federal allocation for the Older Americans Act is pretty minuscule when you look at the whole budget, and it provides a number of services for seniors in need, but there's no way it can meet that demand. Anything that Meals on Wheels can do to help advocate for additional funding or partner with in being able to stretch those dollars further.
So my position entails connecting the natives within our community, which is Native Indigenous, to resources. So that could be federal, state, county, community, cultural. So a lot of ways to plug people into resources. The kind of cultural resources are maybe traditional medicines, maybe a traditional medicine person, a lot of cultural funeral resources. So maybe you need a building for the wake, maybe you need food for the feast, maybe you need wood for the fire. So those are some of the requests that people actually ask for. The main source that it does is my salary, my position. Without that funding source, there would be no there would be no position. I'm grateful as a community member to be able to hold the position and to be able to give these services because there's so much very needed, and I didn't realize this until I got into the position. I guess the biggest changes were just a lot of telephoning. The main thing was, telephoning. All the community events were gone. They were wiped out. At first it was easy checking on everyone, but then as the assignments grew and the connections grew and you grow, as a resource person, and if you do a good job, the word's going to spread. So therefore, you'll have more people reaching out because they feel like you're going to follow through, that they're going to get their real needs met. You know, it's not going to be a dead-end effort. You're going to get the results they're looking for. One of the biggest reasons they're raising, elders are raising their grandchildren and trying to get custody is drug use and drug abuse. So if you talk about a gap or a need within our community, to me it's a pandemic. You can drive through where I live in South Minneapolis and see a lot of drug use, a lot of homelessness. One was even from Canada, still now trying to get her great-grandchildren custody of them. So now you're dealing with another country. So what's the result of that? A lot of kids unsupervised and maybe not eating or whatever the situation is, and the heroes are the grandparents many times. Just to work with elders is a real honor. I mean, they're interesting, they're funny, they got a lot of stories. I know I called one early on and she says, "Thank you for calling, you make me feel important." So yeah, it's very rewarding.